Hello everyone, it's Ryan Liberty, and in this video I'm going to answer the question, what is Schizotypal Personality Disorder, also known as STPD? Okay, here we are, and we're going to answer the question, what is Schizotypal Personality Disorder, also known as STPD? But before I get to that, there are just a few things that I need to say, one of which is that this is not the diagnostic criteria for Schizotypal Personality Disorder. This is just a quick description of it, so it's not meant to be used to diagnose anybody, and only a trained professional should be doing that anyway. If the label of Schizotypal Personality Disorder in any way bothers you, if it doesn't help you to heal, if it just rubs you the wrong way, you can drop the label. This is just to point you towards a set of things that may be going on in your life or the life of a loved one. So if the label bothers you, you don't have to use it. That's okay. We're talking about personality disorders here, and personality disorders are not set in stone. They can be changed. I know that a lot of people think like, oh gosh, it's a personality disorder, I'm stuck with it. That's not the case. They can be treated, they can be changed, and there's always research going on into personality disorders that will shed some more light on what's going on and leads to new treatments. So don't feel like this is like you're stuck with it once you've diagnosed or you've had somebody diagnose you with this disorder. Now, people unfortunately feel like people with personality disorders are bad or evil. There's a stigma out there that I don't like, and I wish people would stop using those words when it comes to personality disorders. So bad, evil, not true when it comes to schizotypal personality disorder or any other personality disorders. However, I do know that many people will come to these videos who are in situations that are abusive with somebody who's not treating them well. And if that's the case, what I would recommend to you, if you're one of those people, is to take steps to distance yourself from whoever it is that's not treating you well and get to safety, get to a place where you can get the support and the help that you need. Don't worry about whatever it is that that person has. That's not relevant. What's relevant is your health and your happiness and your safety. So work towards that. Don't worry so much about what somebody else's personality or whatever is going on there. That's not relevant. So here we are. We're going to discuss schizotypal personality disorder right now, also known as STPD, and I believe sometimes it's pronounced schizotypal personality disorder. I'm not sure on the correct pronunciation, to be quite honest here. Maybe somebody can clarify that for me, so leave it down below if you know the correct pronunciation. Right now I'm just using schizotypal personality disorder. So let's get into it. I've got notes down below because I don't want to miss anything here. It's something that begins with an early adulthood, and you may see any of these things when it comes to schizotypal personality disorder. So it's got ideas of reference, and ideas of reference are when you feel like something is happening and it has a specific it has a special significance without any kind of belief system or anything. So let me try to give you an example here. So if I notice the clock has 10:05, I may feel like 10:05 has a special meaning, but it's not because somebody told me that. It's not because I'm in a religion where 10:05 means something or that number means anything. It's just because I believe that 10:05 has a special meaning. It's not tied to anything, and for some reason I believe that has a special meaning. So that's an example of an idea of reference. Now, they also have strange beliefs and magical thinking that influences their behavior, and it's not normal for their society. So things like superstition, believing in telepathy, clairvoyance, having a sixth sense, all those kinds of things. They have unusual perceptions, including bodily illusions. So they may see that their arm is larger, that they may think it's larger than it really is. For example, many different things could be going on there when it comes to unusual perceptions. They have odd ways of speaking and thinking, so they may overuse metaphors, they may be vague, they may over-elaborate on things, they may speak very circumstantially or stereotyped about things. They have suspiciousness or paranoid ideation, which is that feeling that people are out to get them, basically, persecute them, harm them in some way. They have constricted or inappropriate affect. Their emotions are either very, very tight and they don't show a lot of emotions, or their emotions are very inappropriate. So they may laugh hysterically when it's completely inappropriate at a funeral or something, like out of the blue for no reason. Laugh, get angry, whatever it is. They're odd for obvious reasons. All these things that we've described, they're odd, peculiar, or eccentric in their behavior or their appearance. They lack close friends other than immediate family. They may have excessive social anxiety, but the thing about this is that it doesn't go down upon getting to know somebody or know the people around them. It's rooted in paranoia rather than negative thoughts about themselves. So typically with social anxiety, a big part of that is feeling inadequate and feeling like there's something wrong with us. But when it comes to in schizotypal personality disorder, this social anxiety, it's really about paranoia and that paranoid ideation that we talked about, and it's not really a social anxiety in the truest sense. So this is not schizophrenia, it's not bipolar or depressive disorder with psychotic features. This is not a psychotic disorder, and it's not an autism spectrum disorder, and we call this premorbid if it's prior to the onset of schizophrenia. The good news, of course, with all personality disorders, schizotypal personality disorder does have treatment. You can do things like cognitive behavioral therapy, family therapy. You can get medication involved depending on the symptoms that are going on. Really, the best idea is always to go see a professional, and they will work with you to come up with a treatment plan. And now let's get to what it feels like to have schizotypal personality disorder. So in your body, you may find that you have some possible anxiety symptoms. So things like shortness of breath, racing heartbeat, sweating, tingling of the toes and fingers, any of those kinds of things. As far as the way that you think, you're going to find that you have cognitive distortion, so things like black and white thinking, generalizing, filtering, things like all people who wear yellow are dangerous. You may believe that you have special powers to control events or people, so things like, he chose that for dinner because I thought that he would choose it for dinner. You may believe things happening are because of something that you did. So an example would be, oh, well, I walked around the pole, so now he's safe. Or you may find that you're superstitious, like the number 3 is evil. Or you may have difficulty understanding your own impact on other people. So all that may be the way that you think when you have this disorder, schizotypal personality disorder. Emotionally, you're going to find that you're suspicious of people. You may feel that people want to harm you. You may feel that you're on edge or uncomfortable. And remember, we said that there was a constricted affect. You don't show a lot of emotion. You may, though, feel sad or depressed as a result of this. And behaviorally, you're going to find that there's eccentric behavior. So you may appear unkempt or unorganized in the way that you dress. Somebody with this may have loose speech. The way that they form sentences is a little strange, and words may be used in strange ways. So an example of that might be something like, the cat flied when I clapped, which is, the cat jumped when you clapped, but they use the word flied, which doesn't really even make sense in that sentence, but that's something that somebody with schizotypal personality disorder may do. They have perceptual distortions. They may see things as having special significance that doesn't actually exist. They are uncomfortable with close relationships, and they may appear stiff and inappropriate in social situations. They prefer to keep to themselves even though they are unhappy with not having relationships, which is a sad part of this disorder. Their goals may be unrealistic, and they may have transient psychotic episodes. So it is a distressing thing for the person who's going through schizotypal personality disorder, and it can be frustrating for the people around them, but there is treatment for it, and I would of course encourage you to go and seek treatment if you find that you or somebody that you love has schizotypal personality disorder. I want to thank you for taking the time to learn about it with me today, and I hope I've given you a good human perspective on what it is. If you have any questions or comments, or if you've had experience with it, I'd love to hear them below, and thank you for joining me today. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below, because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. however it is that you're feeling, whatever it is that you're going through, it's okay and you are loved. Thanks again for watching.